ها؟ ما فيش فاتورة ما فيش شيء.
Managed to park all right?
We came by train.
Ah. How sensible. Do you still get chest pain?
Now and again.
Worse when he exercises.
Which is a good excuse not to.
You stop smoking?
Doctor's orders. Dr. Denton, the cardiologist who sent me, he said that an operation was my best option. Cabbage, isn't that what you call them?
Well, I prefer to use the proper term, coronary artery bypass grafting. But Dr. Denton certainly wouldn't make such a recommendation lightly. Excuse me, ma'am. Mrs. Lawson, has Mr. Naziz confirmed his operation date yet? I see, right. Good. Thank you very much. Right. Yes, I have a cancellation in my private list on Monday. Well, my secretary will give you the details of the hospital and the admission procedures, and I'm sure you'll find it very comfortable. Now, the operation lasts for about 3 hours, followed by 36 hours intensive care and a further 5 to 6 days hospitalization.
I seem to have got so much better in the past month. I thought maybe I could stay on the medication, see how we go.
Your angiogram indicates two-vessel disease. Your first heart attack was just a warning of what could happen without surgical intervention.
I read about these other things. Oh, our little lad. These herbal cures. Well, I know they might seem a bit wacko, but they seem to get results. Or that angioplastic thing, you know, with the balloon which widens the artery.
Angioplasty with a Y.
But the thing is, that's just done with a local anesthetic, isn't it?
May I ask where you got this?
A friend of mine cut them out for me.
I'm very aware of your pathology, Mr. Sedgley, through countless other cases that I've dealt with. These herbal remedies, if remedy is in fact the right word, are related only to the preventative aspect. And even then, there's no convincing evidence to support their efficacy. As for an angioplasty, if such an option were possible, arterial narrowings could recur within a few months, and the whole procedure would have to be repeated.
But it says there that bypasses are often repeated too.
Peter.
Mr. Sedgley, if you doubt my clinical judgment, or indeed that of Dr. Denton, you have only to seek a second opinion. And in fact, if that is the case, I strongly recommend that you do so. Mutual trust, you see, is essential.
Monday's fine. Really.
Well, my secretary will be in touch. If you could ask your insurance people to send on ministry paperwork. My contact numbers should you require them.
Thank you, Dr. Pascoe.
No, mister. Only physicians or doctors.
Oh, yes, of course.
I'm sure your friend meant well.